Hello and welcome to Single Payer Radio. I'm Paul Hoppe, broadcasting from the Hayburn Building in Louisville on the WFMP 106.5 Forward Radio Community Network, where news, information, and entertainment is available 24 hours a day, 7 days a week. The views and opinions expressed on our show are those of the speakers and not the station. Single Payer Radio is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded, single-payer healthcare system, commonly referred to as Enhanced Medicare for All, covering dental, vision, hearing, prescriptions, and long-term care, covering everyone starting at birth. Catch our programs at 2 p.m. Monday, 7 a.m. Tuesday, and 11 a.m. on Wednesday. We also stream our show on SoundCloud so you can listen anytime. And remember, this is an all-volunteer radio station and relies on you, our listeners, with your ideas and donations to keep us on the air. Today, I'm joined by Nancy Crew and Kay Tillow, also with Kentuckians for Single Payer Healthcare, with a special guest that I will let Kay, our chairperson, introduce. Kay?
Thank you, Paul. I'm Kay Tillow, and we're here to talk about single-payer health care and to speak with a candidate who's in our area. Would you like to explain who you are?
Yes, ma'am. My name is Randy Raley. I am running in the 15th Congressional District against the incumbent who has been there for about 5 years. Her name is Mary Miller. She is not very attuned to the district's needs. She has brought no federal money into the district for the last 5 years. She won't answer constituents' complaints, no town halls, typical thing like that. And since my representative does not represent me, I'm not a politician, I'm a concerned citizen. I decided to run for Congress last June. And I've been doing that with a district that covers 17,000 square miles. It's bigger than 9 states, and it is a very large elephant of a district, one of the biggest ones in the country. So the problem is that you can't get to see as many people as you would like to see in a district covering 35 counties, but my district is 85% rural. Farmers have had a tough year this past year, and so I have in my campaign a 3-part plan to hopefully revitalize and regenerate, if we can, rural America. And one of the parts of that campaign, one of the points is a single payer healthcare, so farmers don't have to declare bankruptcy over medical bills. It's just crazy that we're the only country in the world that doesn't have some form of this, and the people who need it the most are the ones who suffer the most. And so I think that's one of the main concerns of rural America right now, is that health and medical bills are just, as we know, through the roof, and it's really hurting our farmers very badly.
Okay, and then Nancy, would you like to explain who you are?
I'm Nancy Crew. I'm a retired public health director who lives in central Kentucky, and I'm an AmeriCorps alum and a community volunteer. I'm also an Iowan. My family lives on, my dad was from Carroll, and my mom was from Waterloo, and I have family who live in Carroll, a big farm family, so I'm very interested in the impact of the healthcare insurance crisis on rural families, not only in Kentucky, but in the Midwest. And very glad to participate in this discussion.
So we're all into rural healthcare, particularly since we've seen that the recent cuts that were enacted in a bill that was the budget reconciliation. It was last July, makes a number of cuts, and following those cuts, there has been a lot in the news about the closure of rural hospitals that will be suffering even more than they have been. And we'd like to ask about, is that a problem, a concern in your district?
Yeah, absolutely. It certainly is. Again, my district is very, very rural. It's very poor. And a lot of people relied on Medicaid, Medicare, and it's going to be catastrophic for my district. It really is. We are going to lose hospitals, which when that happens, then you have these good paying jobs that leave the community, and those good paying jobs support other jobs in the community. And when that happens, it's another nail in the coffin, so to speak, of rural America. I think that, you know, uh, if we can kind of grasp the amount of people in my district that will be kicked off Medicaid. In my district, it's somewhere between 26 and 27,000 people that are going to lose their health coverage. And my thing is, okay, if we close the hospitals, what happens to grandma? Uh, she has to come home. Somebody's going to have to quit their job to take care of grandma, and there's no net for that. There's no, that's how people lose their farms, and that's how people lose their life savings. And I've always thought it's a bit of shame that we can't come up with something, you know, like the Canadian health care plan, which would, look at all of the farmers that it takes care of up there. It seems like that they've got it pretty well together. But I think if we lose these good paying jobs in these hospitals, and they start falling by the wayside, and the SNAP benefits go away, and the Medicaid goes away, I really don't know what's going to happen to my district. It's beyond the pale, beyond the imagination, as far as I'm concerned.
And the whole country is facing, a similar situation. I think we've seen that Senator Markey put out a study by the Shep Center, which is in North Carolina, that projected that 338 of our rural hospitals are going to be closing over the next period of time because they're all put at risk because of this. So what we see as the only real solution to that is to fund those hospitals publicly, and that precisely is what single payer improved Medicare for all would do, is to publicly fund the hospitals that are needed to maintain an infrastructure, a system. Do you think healthcare is a human right?
Absolutely. Absolutely. No question, no hesitation. I do believe it's a human right. It's a human right everywhere in the world, it seems like, but here, and we're supposed to be the richest company in the world, but yet I think one of the reasons why it's so expensive here, you could just line it up with the insurance lobbies, with Citizen United, with money in these elections. Now these representatives and senators owe back favors for things done for them, and I think that that's a real reason that we're still talking about this, is that there's so much money from the insurance companies. What happens if they get a single payer system? Well, what, they're out of work. We don't need them anymore, and so I think that there's a lot of pressure there. But yeah, oh, absolutely. Back to your question, dead stop. Absolutely.
I think Kentucky's in a kind of in a similar position. I always like to think of us as kind of like a little brother to Illinois, because Illinois has Chicago, which is like a separate state.
Yeah.
And in Kentucky, we have Louisville, which is sort of like a separate state. And of those hospitals that Kay mentioned, 338 of them in the country, Kentucky has 35 of them. So we're number one in that regard, and we're not too proud of that.
So let me ask a question. How does your governor deal with this? What's the word from Lexington on this?
Well, it's Frankfurt is where the capital.
Frankfurt. I'm sorry. Frankfurt. I'm sorry.
That's okay. Well, it's near Lexington. It's all the same. I am not aware that our governor has taken any position on this particular issue. I know he's projected to be a candidate in the national elections, but as far as I'm aware, he hasn't taken a position on what form of health care he would propose.
I was just curious.
Okay, I saw that your lieutenant governor is running for the Senate, right? You have a Senate race going on in your state?
Mr. Durbin has retired, and so his seat is up for grabs in the general election. Our primary is March 17th, and St. Patrick's Day. Funny how that works. And we're there's a number of candidates running for Dick Durbin's seat. We've got a guy named Kevin Ryan who I like very much, who is trying to get rid of the dark money, and he rides around the state in a bus, and he is also for single payer health care. He's a veteran and a teacher, and that's a part of his plan too. So I'm thinking that with this new, hopefully, group of Democratic leaders who replace I'm running to be a new Democrat. I'm running to be Melanie Stansbury and James Tallarico and Gavin Newsom. I'm not running to be Chuck Schumer and Dick Durbin. We're trying to maybe form the party into something that we can get done. I believe that all of us, most of us who are running for office, are in favor of some kind of single payer health plan. And hopefully that bodes well for the future.
That's an amazing fact to say that.
Yeah.
It's because I think it may be that our time is coming, and what we were unable to put on the nation's agenda in 2009, 2010, when the administration then passed the Affordable Care Act, may today be possible because we've come to the end of what that reform can do, and we're still paying double what other comparable countries pay for healthcare. I'd like to just talk about that just for a little bit. I don't know if you're familiar with the Commonwealth Fund, did a study about comparing wealthy nations, industrialized nations like ours, and their healthcare systems. And what they found is that, sadly, the United States has a failing healthcare system, that we come in at the bottom of the countries such as Australia, Canada, France, Germany, the United Kingdom, etc., in terms of performance and in terms of life expectancy. And yet we come in at double the cost, which means that our people are not getting what they deserve, and that it is possible to have a better healthcare system for less money. So that's what I'm sure you get the question, well, how are you going to pay for it? And when you get that question, what do you say?
Well, here's the thing. If I can back up a little bit, when we're talking about that, the Democrats are pushing this. You know what? I think what's happening in the country is people are opening up their envelopes and they're getting their insurance bill and they're going, I can't do this. We physically can't do this. Is there something else? And I think that's where I think we're going to make our inroads with this. Is there something else? How do we pay for it? Well, that's a question that's going around since the beginning of time. We certainly have enough money to pay for everything else that seems to be going on. And now apparently we're going to get ready to invade Greenland. I don't know where that money's coming from. I don't know where the Venezuela money comes from. I don't know where any of it comes from. But if we're going to spend money on something, we should spend money on the health of our own citizens. And I think that what has happened with the wealth inequality in this country. I was speaking the other night, and I was speaking to a group of farmers. Believe it or not, I got in front of a group of farmers, and we were talking, about all of this. And some guy was kind of mad that I was thinking that we could have some kind of a tax. Let's just say, Leon is making $700 billion a year. And just like they're thinking about doing in California, if you got 5% of that, that would be $35 billion. If we start enforcing some of the loopholes with, with corporate income taxes. Let's face it, we're all being ruled by corporations. And I talked to that with the farmers, and you've got 4 meat packers to choose from, you've got 4 grain producers to choose from, you got 3 seed, and those seed producers tell you what to grow, when to grow, and how to grow it. Now, you think those people should have some kind of stake in rural America? Well, I do, because rural America is certainly making them richer than ever. Their profits are higher than ever. And the thing that I got the other night with the farmers is that big ag is killing them. That's the problem. So when I talked with these farmers the other night, I said, hey, here's one thing that we can think about, maybe having a wealthy tax. Back in the 60s and 70s, when we were going to the moon and we were building stuff, the tax rate on the rich was 70%. Well, it's what, 35%? Now it's half. And we don't have any money. We've spent all of this money on these trillions of dollars on Vietnam and on Iraq and Afghanistan, and we don't have any money left. So the thing that I try to get through to people is, how do we pay for it? I believe that the people who have gotten rich on the backs of rural America need to turn around and take care of rural America a little bit. And so we find money for everything else, but boy, we sure can't find money for our poor, can we? That's and this is the greatest country on earth. So I don't want to start sounding like an episode of West Wing here. So,
well, that's a great answer, but and that's certainly true. I mean, all of your points are well taken. But in addition, if we look at the healthcare systems that are performing better than ours, we find that they are costing less. And therefore, if we can simply end the funneling of our healthcare funds through the for-profit insurance corporations, we can have that money go to healthcare rather than to the profiteering and the administrative costs that they cause us.
I remember back when hospitals were, I believe they were required by law to be nonprofit. That's a long time ago, but I remember that hospitals were not a profit organization. And now they, here in St. Louis, Barnes Jewish has taken over absolutely square miles in here in St. Louis. Now, good for them. They provide great care, but there just seems to be an inequity here that, the people from rural America, I'll just go with St. Louis because I'm right outside of St. Louis, and the people in rural Missouri hate St. Louis until they need St. Louis, and when they come to St. Louis, they can't pay for it, and that's just it's to me it's heartbreaking. It really is when you dig down into the deep, how this insurance part of our lives that I believe is a right has failed us so much and caused so much debt and bankruptcies and suicides. And that's the big problem that we're having in my district when it comes to the farmers. They're killing themselves literally because of the debt. And it's sometimes farm related, sometimes it's medical related. And farm suicides in my district are up like 37% year over year. And so this is one of the reasons I'm running, is because this isn't right. It's not right. And my competitor is aligned with those. She is very wealthy, and she's proud to say she's Trump approved. And so we're never going to get any relief from her in this district when it comes to a single payer plan, because she likes the way things are, because she's getting greased by the insurance lobbies. That's the kind of person she is. So that's one of the reasons at the age of 69, I'm deciding to run for Congress, is because this is just not right.
You're definitely right on that.
If I may, I did a little research, and I was trying to come up with a plan that a single payer plan that suits the farmers, just to let you know what I came up with. And it seems like the plan that would be the best one for farmers would be Canada's single payer plan. It's universal coverage regardless of income or employment, no premiums tied to yearly income swings, minimal paperwork, a very strong rural focus. It covers farm injuries automatically. It's zero premiums or employment ties. Strong primary overall tax rates are good. It's the best balance of simplicity, universality, and rural suitability. One of the other things that I'm campaigning on when it comes to healthcare and single payer is the drain of these people, professionals from rural America. They go to high school in rural America, they go to college at maybe the University of Illinois, and then they leave the state and go to the big city. One of the things that I'd like to put in to help healthcare in this district is kind of a payback that I call. So if you come out of college with $30,000 in student loans, if you sign an agreement to base your residence and your practice in rural America, at the end of 5 years, those debts are wiped out. I would do the same thing with the veterans of the VA. If somebody gets out of medical school and say you owe $40,000 of student aid, if you want to go to work at a VA and say sign a contract for 5 years, then you do your job at the VA and those debts are eliminated. And I think that would really help out and really help keep our hospitals and our VAs with more talent, and I think with more passion for their work. So I'm just trying to think of ways that we can keep rural America together. And I'm thinking that maybe if we have, some kind of tax break or pay off student loans, we can keep talented people for a while.
It's an interesting proposal. I know we've seen the statistics that say when a rural hospital closes, that the mortality rate rises by 5.9%. So we can't say that it's no big deal, just let them go to the city hospital, or we're going to have telehealth, or those things will not adequately give people access. Do you agree with that?
I do. And the thing about telehealth, let me expand on that a little bit. One of my platforms on my campaign to help revitalize rural America is broadband access for everyone. Everybody in my district, parts of my district are very, very, very rural, and they're out there in the boonies, as we used to call them. And if we can find the money's there, it's in Joe Biden's infrastructure program, but my representative refuses to release the money. If we can get broadband to every person who wants it in my district, when you talk about telehealth, no, that is not something that should be acceptable. But in the case of an emergency, if we can get broadband to these people who may need some kind of telehealth or, all of that, I want to make sure that, every resident has access to that. I think what's going on, and if I may, and I've talked about it before, is that we're going to have to find some way for politicians and the people who are supposed to be looking out for our best interest to start, and I know it sounds very cliche and all of that, to start listening to regular people. Now, what's going on now it is crazy, but I think what's going to happen is I think there are going to be enough people, and I hate to say it, and it's too bad that it has to be this way for anything to change, but I think that people are now starting to open their eyes that we are so controlled by the corporations that are run by the millionaires and the billionaires and the insurance companies, who are now going to go through our records and by AI determine who gets accepted and who gets denied. And we have gotten so far off the track here, Kay, that I'm not so sure we know where the track is. We've got to find our way through the snow to get back to the track before we can even fix anything. And that's how badly I think healthcare has deteriorated in this country, that the only thing that anybody cares about now, and it's been this way for a while, is not, the patients that you can save, it's the money. you can save. And I think slowly but surely, I think some eyes are being opened here.
Well, that's certainly a big issue because the denial of care, whether it's done by artificial intelligence or whether it's done by somebody paid by the insurance company to increase their profits, that denial is a big piece of why we have to have an improved Medicare for all. Because, who should determine whether a treatment that is prescribed by the physician and is wanted by the patient, why should there be someone else who makes the decision other than the professional physician that the patient has chosen? Why shouldn't that be the opinion that is followed? And by what right do we turn over to an insurance industry the decision and the ability to demand prior authorization, to allow denials of care, which often delay the care? And when you delay care, it's like denying it. We have here in Kentucky doctors who say that they can't get MRIs approved. That's the scanning process that allows for an appropriate diagnosis. And so you can't diagnose if you can't see the problem. You have to be able to use the technology that is available. So when the insurance industry denies the MRI, they deny the treatment because there's no way to get to an accurate diagnosis without that. And we have a doctor in Northern Kentucky who said she's practiced over and over again. The MRIs are denied by the insurance industry, blocking her ability to actually perform her physician responsibility.
An anecdotal story from along the campaign trail. I was talking to a gentleman whose brother is a surgeon, and we were talking about the insanity, I call it, of our healthcare system, the abomination that we're living with here. And he said he has a brother who had a patient who was in the hospital and had like an aneurysm, and they were trying to get the insurance clearance. And as he's in the operating room operating on that, he gets word that the insurance has declined the request, denied the request. And he said, God bless my brother. He said he took the Hippocratic oath, and he was not going to let an insurance denial stop him from what he was doing. But this is literally what we're living with. This is madness, is what it is. And I'm thinking that any kind of program has got to be better than what we're dealing with now. But as you know, and hopefully I'm getting ready to find out, there's a lot of money up there in Capitol Hill, and there's a lot of billions of dollars lying on the table for people who don't want this to happen, because they will lose their golden goose, so to speak. And so the opposition to this is very large. And so I think, like I said, I think people are starting to get their eyes open that, and for us, I can remember back in the day, and I'm sure you do too, that we would get we didn't have an internet or anything, but every once in a while we'd get a newspaper and say, hey, the United States is number 2 in mortality. We've got one of the highest standards of living in the world. And boy, oh boy, that sure isn't the case anymore. And in your article, you said that we're 33rd, something like that?
We're 49th.
49th, yeah.
49th. And, it's predicted by those who've done the study that in a few more years, we're going to be 66th, which is just outrageous that the wealthiest country on the face of this earth is doing a really failing job of taking care of our people, which ought to be number 1 on the list.
You would think so. And I'll bet you dollars to donuts that if you did a breakdown by a financial demographic, you'll find out that the rich people outlived the poor people by a much greater margin. So, you know, that percentage that we're talking about, what it was 73 years or something like that. Well, I'm almost in, and there's no data, and I'm just kind of, but I would be thinking that on the top of that, on the top end of those 73 years would be people who have access to quality health care, and that the people who don't are the ones bringing that percentage down. And if you don't have access to, here's the thing, being, and I'm kidding now, being a man and, you know, oh, I'm not hurt. I'm not hurt. Everything's okay. You know, poor people, when that happens and they don't have adequate care, they don't do anything about their aches and pains, and their aches and pains turn into serious problems because they're not dealt with. And that's one of the things that happened to my mother, is that she had aches and pains and aches and pains, and found out she had a cancerous tumor inside her spine. And so, you know, and I'm sure that in the poorest of Kentucky or Illinois or Missouri or wherever, you find people that just don't go to the doctor because they can't. And that, to me, is one of the reasons why I'm so, you know, like I said, the single payer is part of my 3-part plan that I have put together to hopefully revitalize rural America. It's almost like an FDR thing. I'm obsessed with trying to find a way to get people to invest in rural America so we can, you know, build it back up again and make it attractive for people to live there and attractive for people to stay in their hometowns, because there's something that's keeping them there. And right now, as I travel through my district, I see boarded up building after boarded up building after boarded up building. A town that had 8,000 people making cereal boxes or something like that. When that cereal box plant left, well, now that town of 8,000 people has 2,200. And the only reason it has 2,200 is those people can't leave. And we're finding that one of the things that is contributing to healthcare is what I like to call grocery wide spots. What I mean by that is grocery stores are leaving small towns, and a grocery desert. And then if a grocery store leaves a small town, where do those people go to get fresh groceries? Dollar General? You know, no. So they have to drive farther to get the food that they have to have. And so this is all, I think, intertwined together. And I think, again, the biggest problem in rural America is the debt that's left behind by medical bills and things like that. And that's why I'm so passionate about this. And you know, some of the more I did some research about, you know, which plan does which country use. And it's funny because you'll find that there are 4 or 5 countries that use this plan. There are 4 or 5 countries that use this plan. There's another 10 or 11 that use this plan. And it's interesting to see how the plans differ throughout the world. But the one thing that doesn't change is that it's a single payer health plan, and you don't have to pay anything. And it's some are funded privately, some are funded publicly. You know, it's just interesting.
You know, one of the things that we saw coming out of the Affordable Care Act, which was passed in 2010, of course, we were working back then to put single payer healthcare on the agenda, and the people who worked to get that plan on the table were arrested for trying to get into the hearings that were being held. And we're very hopeful that this time around that there's a better understanding and more people will be able to support it and actually get it onto the nation's agenda. But one of the things that happened with the Affordable Care Act was that more people got insurance, but of those who were insured, more of them still could not afford their health care. Yeah. Because the insurance company has been raising the deductibles and raising the copays and requiring prior authorization, or sometimes saying this is the network of doctors you can use, And so the cancer center that you need isn't on the list that's approved, and therefore you can't get to the system that you need. And so we have more people who nominally have insurance, but who cannot use it because of the cost. So that doesn't get us much further than where we are back in 2009, when we had 50 million people that were totally uninsured. Now we have more people than that who are either uninsured, perhaps something in the area of 30 million, but more people who are underinsured, and their insurance is not providing them with the ability to afford the care. And that's tragic. And I know you talked about the suicide rate. We had that here in our local area with a farmer who, when he found he had cancer, rather than taking for himself the funds of the family that would be needed for his treatment, he shot himself to preserve the family farm for the rest of the family. That's inhumane, that's tragic. A system that requires that for someone to be able to pass on the economic stability to their family is insane. And we have to fix it, and we have to demand from Congress how we do it. How do you think we're going to get this passed?
Well, number one, what's going on now is unacceptable. And it drives me crazy. And when you were talking about the Affordable Care Act, yeah, it was kind of a Band-Aid on a jugular wound, but I know that it covered my daughter, and while she was in Los Angeles, and it was really a godsend to her. So I know that there were a lot of problems with it, and maybe it wasn't thought through. Yeah, how do we sell it? How do we change it? Well, we've got to start communicating to the people. We've got to start communicating. As a politician, just let me tell you, I'm not a politician. I'm a retired radio guy, okay, who's a very concerned citizen and who's trying to do something to save my country. One of the things that I talk up to my people are, how do we get to them? Okay, there's going to be 30%, maybe less by the time the election comes around, that are true MAGAs, that don't want to hear anything about anything because they don't know how things work. They just don't know how things work. But we had 240,000 people in my district last election that did not vote. They didn't vote. So how do we get them to listen to our side? I think like I said, in my district, it's very rural. Trump is still very, very popular, though not nearly as popular as he was. So we try to find some common ground with the people who are not the MAGAs, but concerned for the future. And I think that includes a lot of people in my district. I always try to say, let's approach our neighbor with empathy and sympathy and hope and respect, and say, hey, you know what? He said he wasn't going to raise prices on food. He said he was going to release the Epstein files. He said he was going to be the no war president. He said this, he said that, he said that. How's it working out for you? What's the price of your hamburger, your electricity? And so if we talk to them like that and let them, like I said, you're not going to reach everybody, but if we talk to them and say, hey, you know what? We have a better way. And one of those things in that better way is a single payer health plan that will, in the long run, save you thousands and thousands of dollars, because you don't have to worry about skinning some insurance executive's palm or anything like that. So that's one of the things that I think my big guy, one of my heroes always is Robert Kennedy, his dad. Okay. And Robert Kennedy was about reconciliation, because as you remember, in 1968, this country was in flames. And the thing about Robert Kennedy that he said was, let us reconcile with each other. And I know down here in my district, it's what the farmers went through this past, the corn futures are still not where they need to be. They're like 60 cents a bushel away from making any profit at all. And I think now is the time that we approach those people and just say, hey, look, we've got a better way. We don't want to throw your grandma out of the hospital on Medicaid. We don't want to punish your kids by keeping your SNAP benefits away from you. We don't want to close the hospital that you depend on. Give us a chance, because in my district, I can tell you, I don't think the Democrats have been talking with the people. I think we've been talking to them, and I think we've been talking at them, but I really don't know if we've been talking with them. So that's one of the things that I'm trying to do, is say, hey, did you really vote for all of this? Well, we think we've got a better way, and part of that better way, and part of my better way, is broadband for all and a single payer health system that once you pay into, you don't have to worry about it. Everything is taken care of. And we're just going to have to knock down those walls and open those doors very, very slowly. But I think there's a bit of a disturbance in the force, as Luke Skywalker said many years ago. Um, and I think that people are now more open to listen, because what we're doing now just isn't working. It's not working. It isn't. And I think people are starting to realize that it's not working. The only people getting rich are the insurance companies and the hospital executives. They're the only ones getting rich. So I think we're in a little kind of strange time in the history of this country. And I think slowly but surely the pendulum is heading back the other way. And so that's the only way that I think about selling it, is find common ground and letting these people know that I believe we've got a better way that will save them thousands of dollars and make sure that they're fully insured.
Sounds good. We have to get those people out who think that their vote doesn't matter, and get them to start using that vote too.
Well, that's one of
I
the things in my district that I'm doing, is I'm going to the bars, and I'm going to the cafes, and I'm not going to any of the churches, because I don't think that mixes, but I'm trying to get to where people are and just say, exactly what you said, hey, you've got to be able to make the change. You have to vote. And like I said, if 240,000 people didn't vote in my district, if I get a third of those, I'll win this election. I'll win the election. So those are the people that I'm going after, are the people that, while Republicans, and let me give you a real quick example. The other day, I met with the regional superintendent of schools for Madison County, which is right outside of St. Louis. It includes Edwardsville. He's a Republican. And we sat across from each other. He's embarrassed by Donald Trump, and he does not like his representative, the person I'm running against, at all. But we sat across the table, and for 2 hours, he was telling me ideas on how to fix rural schools. Okay, he's a Republican, I'm a Democrat. We found 85% of the time we agreed. We agreed on stuff. There were 15% of the stuff that we didn't agree on, but that's okay. And I think if we can, again, just find some way, some common ground, whether it's a sports team or kids or whatever, to just start those conversations and just, hey, it doesn't have to be this way, kind of thing. And I think the first thing that, when starting those conversations, I bring up is single payer healthcare. That's the first thing that I bring up, that what we're doing now isn't working, and it isn't working.
I don't know if you've had a chance to take a look at the recent poll by Data for Progress.
I have not.
But it's an interesting poll, because it says that voters support Medicare for All by 63%, even when they are told that it will raise their taxes and eliminate most of private insurance. That's an amazing thing. And
it's only going to go higher. It's only going to go higher.
And let me just give you the other. Now, among Democrats, that figure is 78%.
Mm-hmm.
Among independents, support for Medicare for All is 64%. But among Republicans, the support is 47%.
Oh, wow. That's better than I thought.
But if you look at it, those who are opposed or strongly opposed are 46%.
Wow.
Which means that even among Republicans, according, this is last November by Data for Progress, and even among Republicans, there was a 1-point advantage over those who were opposed to it by those who were in favor of Medicare for All, which seems to me that now opens the door for political figures to say, okay, your money's on the other side, but this is where the voters are. This is now a politically viable issue throughout the country, even in rural areas. What do you think?
There's no question about that. And just think about those figures. Fully 2 out of 3 people in this country are on board for Medicare for All. 2 out of 3. Now, if you take those and look at the presidential approval ratings, fully 2 out of 3 people do not approve of the job that he's doing. So I'm thinking there's some kind of correlation there, that as a country, we're hopefully starting to wake up and realize that, it seemed like a Shangri-La a year and a half ago compared to where we are now. And I think that as the president loses his popularity and I think there's going to be a correlation to where people are going to be going, well, let's see what else is out there that we can do, because we need strong Democratic candidates who are going to follow through with this and make sure that this is a part of what I'm calling a new Democratic Party that I think we have been far too silent, far too long. And I think if we don't start speaking up, we're going to get what we deserve. And this, to me, has to be one of the most important things to deal with here in our lifetime, to be honest with you, because as we say, the only people getting rich here are the stockholders of the people who make the decision to deny treatment. And this is not the way this is not the Schoolhouse Rock America that I remember. This is not the America that was taught to me in high school. This is an America that I don't recognize. And that's one of the reasons why I've decided to try to change things.
Thank you for that. I just wanted to insert here that Kentuckians for Single Payer Healthcare is a nonprofit, nonpartisan group. We don't support or oppose candidates. We are interviewing candidate Randy Raley, who's running in a rural district for Congress in Illinois. And we offer to any other candidates in his district, if they choose to have equal time, we would be glad to give them that equal time. We are talking to this candidate in order to elucidate the issues around a single payer healthcare plan in our country. And we have a little bit of time left. Nancy and Paul, would you like to make some comments on this?
Well, I think you've certainly very clearly and hearteningly and unambiguously stated your support for single payer healthcare. And there are arguments that on a one-on-one basis, I would buy into if I were one of your constituents. But it's a big district. It's a lot of work. To get to everybody. I'm curious who your partners are, what other organizations, grassroots and otherwise, that you're working with to get your platform, especially the single payer healthcare message out to the voters.
Well, I when it comes to single payer healthcare, here's the problem that we have in this district. We get very few endorsements until the primary, because I have no idea why that. It's crazy for me because okay, after the primary, well, you mean you're not going to endorse me? But they don't do endorsements in primary. One of the things I have been endorsed by is the Downstate PAC, which is an environmental a pack that in Illinois here we've got a little problem with how to store carbon emissions, and they're thinking about drilling a hole underneath Decatur Lake and putting them down there. And it's like, no, we can't be doing that. But it's as far as working with other organizations, I got to tell you that I really don't, because here again, it's just hard to get anybody to get an endorsement. And it's funny because there are 3 other people running with against me in the primary. And there are 3 of us that have kind of become really good friends, and we have dinner with each other and all of that. And the reason is that we've been on the road with each other at the same place with each other since summertime. And we all have pretty much the same values. I think my message is more clear and more concise, and I have policies, and I have a platform and all of that. But I do have many friends in the medical field that I consult with and that I talk to. I have a friend of mine who is an ER surgeon, a trauma surgeon, and I'm always asking him to tell me what doctors need. How his deal with doctors is that just so much paperwork, and he says it's becoming the way that teaching has gotten, is that they don't let doctors be doctors. They've got to worry about so much other stuff. And like with teachers, it's like, when you go to school and you learn to be a teacher, that's what you do. I would never say to my plumber, you're doing that wrong. But his deal is that it's starting to become so corporate and so cutthroat. And it's all about get them in, get them out, get them in, get them out. And that's on another subject that I'd like to talk about is, providing, like before, providing help for our doctors and nurses who want to be in rural America and all of that. So I think it intertwines with a lot of different things, but I am, as far as nonprofits or anything like that, not really, but I do have a cadre of professionals that I try to get information from.
That's great. That's great. I'm grew up in Metropolis.
Oh, you did? Ah, Superman.
Which is somewhere down there. And
yeah, that's about as close to Kentucky as you're going to get without being in Kentucky.
Well, I actually was born in Paducah, Kentucky, because you couldn't get born in Metropolis because there wasn't a hospital there back then.
Yeah.
Now there is, and the problem is that the Metropolis Hospital is among those listed as endangered and will be slated to close unless we can get some change in this system. And that's a terrible thing for me to think about, that the people I grew up with wouldn't have health care. I recently read an article by a woman who writes for Fierce Healthcare. She grew up in Carmine. She said, where Carmine is? And she says her hospital in Carmine has now closed. And she is speaking about that problem of these rural hospitals throughout Southern Illinois that are slated for closure. So that's one of the reasons why we think we can win rural America to the support of single payer, because it does provide the operating funds to assure that these hospitals remain alive.
So that hospital closed in that town, what's the incentive for the rest of the people to live there? You know what I mean? And that's the thing that just drives me crazy. And I for 5 years out of my life, I lived on a farm in southern Missouri. I was a working farm of 159 acres. And so I know the discipline that it takes to run those farms, and I get it. And it's a very, very dangerous occupation too. So we've heard so many times about a farmer that, tractor rolled over on him or something like that, and he couldn't get help because the hospital was 65 miles away. And again, I think it's insanity that the quote unquote richest country in the world, well, we're really not, treats its citizens like that. And I think something needs to be done about it.
Great. You have any final words to say, Paul?
I do. I would like to thank Randy, for his dedication to our cause. And the other thing is, should you get elected, I think one thing that you should definitely be tuned into fighting for is the return of Citizens United.
Oh, yes. Oh, yes. That, dead stop. Absolutely, without a doubt. I'm totally with you. I am for term limits, and I am against stock trading in Congress at any time.
The other thing that's interesting that you may not know is that since 2003, every Congress has had a single payer bill introduced into it. Since 2003, that's how long we've been in this fight.
Money,
And
money, 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 money,
there you go.
money, money. We got to get it out. Got to get it out. Got to get it out.
Got to get the money out of our political system
Yep.
and the profits out of our healthcare system, so that
Just to let you know, I'm not taking any corporate money. This is a very grassroots campaign. My grass needs to be watered, but we're doing what we can here. It's trying to make the most with a budget and a message. And I think that I've got a better message than everybody. And so I ultimately think that's the thing that wins. And before we go, I want to thank you guys so much. This has been great. I've had a great time. I hope we don't lose touch. It's been nice to make your acquaintance over this next hour, and let's please make a promise to stay in touch, all of us.
Okay, thank you, candidate Randy Raley, and I think it's the 15th congressional district.
15th, yes, ma'am.
In Illinois, it spreads across the central part of the state. And the rest of us here talking are Nancy Crew, myself, Kay Tillow, and Paul Hoppe. We are with Kentuckians for Single Payer Healthcare. You can find us at kyhealthcare.org. We'd love to hear from you, and please share our radio shows with your friends. Signing off for Single Payer Healthcare and Single Payer Radio.
This is Paul Hoppe. I want to thank Kay and Nancy for joining me on the program today, and also thanks to Randy Raley, who joined us from Southern Illinois, where he's running for Congress in the 15th District. Randy, we wish you success in your primary bid for Congress. Special thanks to our listeners. If it were not for you, it would not be possible for Forward Radio WFMP 106.5 to exist. Have a wonderful rest of your day. Thank you.